Hi, everyone. I'm Leah Gauguin, and thanks so much for the invitation to be here today. As you know, Vanessa's law comes into effect in 10 days on December 16th. So we have a quick presentation, lots of time for questions. I'm going to show you where to find some additional resources that can be helpful. So today we're going to an increase in reported cases to Health Canada. It will provide Health Canada with more data so that they can identify issues with particular therapeutic products and medical devices quicker so that they can make changes and make our delivery of healthcare and the products that we do safer. So today we're going to just quickly review the threshold for serious adverse drug reactions. We're going to discuss the mandatory reporting responsibilities in Horizon Health and identify some field reductions. So this is the threshold for serious. The definition that comes from Health Canada for a serious adverse drug reaction is a noxious and unintended response to a drug, regardless of the dose of that particular therapeutic product. So we'll consider it serious if it meets any one of these criteria. So if there's death, the patient dies, if the patient experiences a life-threatening condition, persistent or significant disability or incapacity, hospitalization, an extended length of stay for that patient, congenital malformation, or if there's significant medical intervention that's required, it could be an emergency or in the hospital setting, that will prevent any of the outcomes that are listed above. So we do have a checklist that we've developed. We're looking at printing it in a pocket card. Right now it's available in a PDF format, so you can just print it off. So we're looking at pocket cards for healthcare providers, and for physicians, they would prefer posters close to workspace and into areas. So we're having those printed down. So as far as mandatory reporting responsibilities in Horizon, the healthcare team, so any member of the healthcare team is responsible for identifying the suspected serious adverse drug reactions or medical device incidents. And this is the entire healthcare team. So it could be nurses, it could be physicians, pharmacists like yourself, other allied health professionals. And if we're talking about medical device incidents, it could be anyone who's on the EBS team or porters. They may be involved with particular cases of medical device incidents. So the identification is really the key. And after an event has been identified or suspected, it should be reported to the manager within 24 hours and then an incident report completed within 24 hours. In addition to that, you're going to document it typically would in the clinical record of the patient. So once we have an incident report, that incident report is the flag to risk management. So it's really just the way that risk is going to be notified of these particular cases. Once we have that incident report, we're going to verify that the case meets the threshold for serious, and then risk management is responsible for reporting on to Health Canada. So we have that responsibility. And we have to do that within 30 days of first documentation of the event. So the key things to remember to document in the incident report, keeping in mind this is just the flag. Your clinical documentation is really where you're going to have all of the details. So the incident report should include who the patient is, so identify the patient, specify the date when the serious adverse drug reaction occurred, and then just provide a brief description. So enough for us to know that it's a suspected serious adverse drug reaction, and include the name, so the same as what would be recorded in the medication administration record. So it's really those pieces of information that are key in the incident report. You don't have to repeat all of your clinical documentation in the description. In some areas, they have a limit on the number of characters. So it's 150 characters that a person can use for their incident description. just keep it very brief. So serious adverse drug reaction and just enough so that we can take those pieces in the flag and go into the clinical record to find the additional details. And your clinical documentation is going to be as you typically document. There's nothing new in your clinical documentation. So include the date that the serious adverse drug reaction was first noted and when it's documented, the date for documentation, a complete description of the serious adverse drug reaction. You're going to include the start and end date of the effects on the patient, any effects of the serious adverse drug reaction on the patient's health, and any other medical conditions of the patient that directly relate to the serious adverse drug reaction. So this would be as you're working with the patient, things you're identifying, and as your clinical documentation would normally. So since our education session started in October, we have had several incidents reported in our incident reporting system to identify serious adverse drug reactions and medical device incidents. Very unfortunate for our patients, but it gave us an opportunity to see how readily available the documentation is in our system. So we the basic information was included in our incident report, and then we went to the clinical records of the patient using EMR through Meditech or PCI, and we investigated the case to see what was available. So we were able to get a significant number of details. What we'll do is use the incident report as the flag, go into the clinical record, and capture the other mandatory reporting data pieces. We're not going to be going back into records multiple times. I'm the one person for Horizon assigned this task, so I have access to the other areas, their electronic system, but we won't be doing full chart reviews on the cases. We're just getting the data elements that are readily available and submitting that off to Health Canada. Medication order history is also a key place where we're looking for information. So great source for the drug name, dose, for administration, start and end dates of therapy, other therapeutic products that were prescribed to the patient. So it's all in the med order history. That's really it for the presentation. I'm going to show you some additional resources and where you can find some things on Skyline. We're updating our Skyline page all the time to include resources. As people get back to us and say, we really would find this helpful, we're creating more documents and placing them there. We do have a new incident reporting system. It's a provincial incident reporting system coming into the new fiscal year. It is provincial, so it's standardized across Horizon, Intelligence, and Department of Health. It will be more user-friendly than our current system. And the great thing about it, it's a standardized system, so it'll be the same in every area. We expect that it's going to facilitate completion of incident reports. So the training that's related to Vanessa's Law is all going to be incorporated in implementation and the rollout of that new software. So you'll continue to hear lots about Vanessa's Law through the coming months. All right, so I'm going to take you to Skyline. And up at the top, departments and programs. On the right-hand side, you'll see risk management. And on the risk management page, along the left is Vanessa's Law. Click there. Brings you into our Vanessa's Law page. And as I said, this is dynamic. We're changing it all the time. Any presentations that we've offered, you'll find them here on the site, including today's presentation that I'm delivering to you. I can show you the threshold for serious checklist. So it's a document that's just a quick and easy one to use. It includes the definition for serious adverse drug reactions, medical device incidents. And if you say yes to any one of the criteria, then it would be considered serious by Health Canada and would require reporting to Health Canada. So I'll be the liaison to apply to Health Canada for any exemptions for therapeutic products that are known to be highly reactive. So I'm working with the oncology group to identify the particular cases or particular therapeutic products that they would like to see exemptions for. Just because if it's a highly reactive product known to cause lots of reaction, we want to identify those particular therapeutic products so that we're not placing a burden on our healthcare team to report that are known to be reactive. So working with oncology and emergency groups to identify those therapeutic products. It's nice. We're going to standardize it, or it'll be all filtered through me, so we won't be double exempting, or we're applying for exemption. And we expect that Health Canada will be getting back to us with exemptions in other jurisdictions, so that we know and we're going to just pass that on to our healthcare system that particular therapeutic products have an exemption and don't require mandatory. Any questions you might have? Anticoagulants. I haven't sat down with anybody yet to identify particular therapeutic products, but yes, that would be one. Mm-hmm. Yeah, so looking at any of the anticoagulants. They are highly reactive. We know they're.
I have a question from Moncton. Can you hear me?
Yes.
So, of course, I work in oncology, and we know we have a lot of adverse-related events, which some do cause hospitalization, especially with the new immunotherapies. So any of those would have to be recorded, even though we know the side effect can occur.
Yeah.
Is that correct?
That's correct. At this point, yes. With those highly reactive therapeutic products, those are the types of products we're looking at exemption for, because we know that it's a known reaction. So at this point in time, yes, report, but I hope to have news for you very shortly to say that you don't have to report those.
Maybe even if we get some degree of exemption, maybe it could even be at a certain level, like a grade 1 or 2 or something that might be able to be managed as an outpatient or a short stay in hospital. I don't know, but something like that even would be better than nothing at all.
Right. I agree, and that's exactly what we're hearing from our healthcare team. So Health Canada will make those determinations of whether products are exempt. It won't come through Horizon. Health Canada's mandated the reporting. The hospitals are responsible for the rollout and for actually reporting cases. So Health Canada has to approve any of the exemptions. Any other questions?
Also, waste of drugs that are exempt?
That would be ideal. That's what we're expecting they will do, yes. And I would expect that outside of guidelines documents that they plan to release every year. It should be more timely than just the one year published.
It's Heather in St. John. I just wanted to clarify, for ambulatory care patients that we would see in our facilities, would the expectation be that we follow the same process for adverse drug reporting if we discovered something in a clinic setting?
If reaction occurred in the clinic setting, or if the patient is reporting it to you, so they've come in for a clinic visit and they're saying, last week I was in hospital because of XYZ, which
yeah.
if they're reporting a history, then no, you would not be responsible to report that. It should be reported as the first clinical documentation where the person presents to with their serious reaction. So the particular emergency department or the inpatient stay, that it would be that location that would be reporting it. If it's historical, we wouldn't expect, and Health Canada doesn't expect to be reporting that.
Okay.
If there's a reaction that's occurring while you're delivering care in the ambulatory care setting, then yes, we would report those ones. It meets the threshold. You know the person's being hospitalized, they're going right off to emergency, you're providing significant treatment to the person before they go off, so they are experiencing an anaphylactic reaction, you're doing the first response treatment and then sending them off to emergency, then yes. Because we are centralizing our reporting, if there's any duplication, I would catch that before the report goes off to Health Canada. Does that help?
Yes, that was helpful.
I don't know. Sure. Yeah. There hasn't been much in the way of discussion about what happens to the data after it leaves our healthcare facilities and goes to Health Canada. So I'm expecting that it's going into a database, and there'll likely be data mining from that. So looking for trends in the data is what I'm expecting to happen. It would be a huge team that they would need analyzing every report that comes in. So I don't know. That's the assumption on my part. The resources that they're discussing, I think that's probably it. Any other questions? Great. So if there's anything that does come up, if you do have questions, feel free to email me. I'm in the global list, Leah Gauguin. Right now, I don't have a permanent workspace, but I do have a phone number. So I'm checking the voicemail regularly for that phone number. So, stay tuned. By the end of January, I'll be at that. Yeah, gearing off right now. Great. Well, thanks for your time.